brings us to your weekly capsule of health information. We like to call it Your Healthy Dose, presented by Hannibal Regional Hospital and Hannibal Regional Medical Group. And we're talking about speech therapy. And here in the house is Emily Hinkle. Good to see you.
Good morning. Thank you.
So let's talk about the role of a speech therapist. What is it that you do, and why is it that you're associated with a medical facility?
Sure. A speech therapist will evaluate, diagnose, and treat people who have any issues with communication, speech and language, cognition, swallowing. We kind of have a big bag of tricks that we can kind of pull from. And in the medical field, we work a lot with stroke victims or anybody with any kind of swallowing issues that they may have from the stroke or from a brain injury or anything like that.
I'm sorry, I had to chuckle when you said anyone who has problems with communication. I think we all do.
We all do sometimes at some point, don't we? Yeah.
But you're talking about folks who do need some assistance with being able to speak and how they do speak.
Correct.
All right.
I think with the title of speech therapist, a lot of people think about enunciation and pronunciation, but
Exactly.
it really is, that's just the surface.
That's just kind of scraping the surface. You're right.
Yeah.
There's a lot more to it.
So who do you serve through Hannibal Regional Hospital? Is it just those stroke victims that need rehab?
No, actually, we are involved in a birth to 3 program. So we work with babies, literally babies, toddlers, school age, teenagers, everybody.
Talking about that right now, how did somebody define that early that their child would have a problem?
If they are having trouble getting their wants and needs across, or any kind of feeding issues too. We do a lot of feeding with babies, cleft palate, cleft lip, or any kind of, if they had some kind of trauma at birth, sometimes we can get in and kind of help with that and help make normal.
I know there's been a surge in the past years with sign language at those young ages too. Do you use that at that point to help out?
Yeah. If it's needed and if family's on board to go for it, then we'll do that.
Is it a parent that makes initial contact with you, especially with the youngsters that they're still part of the family? Well, they're always part of the family, but is it a doctor referral, or do we just make a direct contact to you?
Kind of both. Typically we get a referral from the physician because there's a concern either from the parents or daycare provider or family member. And sometimes we do get parents or family members contacting us through the hospital, and then we'll kind of get that referral to the physician, whoever is appropriate.
Okay. Can a school teacher perhaps maybe
Yeah.
get hold? Okay.
Yep. If they have a concern with a kiddo in their class, yes, absolutely.
That happened to me back when I was in elementary school. My mom and dad didn't know about it.
Really?
But I think things have changed since then.
Sure, I would hope the teacher would mention something to the family.
So all these things need to be kind of in order to begin therapy, to make that initial contact, and then you'll come up with some sort of regimen.
Yes. After we get, are you meaning like kind of the process?
Right.
Yeah, we will get the referral, and then we'll put you on our schedule, get you evaluated, and then depending on whatever specific complaints or concerns whomever has, will evaluate that and decide if treatment is appropriate or not. And if it is, then we'll get on and get going.
Emily, how did you become a speech therapist, and what is your role?
I actually can't, I have no idea. I just was interested. I researched, to be completely honest, I really don't know. Researched it and was interested, went to school, and then my role is I work a lot with the adults in the hospital setting and outpatient setting. There's 4 of us there, and so we all kind of have, everybody has their likes and dislikes, and I've just kind of gravitated toward working with adults. So that's what I do there.
What kind of schooling is needed to be a speech therapist?
You have to have your 4-year undergrad degree, and then you have to go on and get your master's too.
Okay. And what is needed in order for therapy to be started? If somebody needs to set up an appointment with you, do they need to, I think Rich might have asked that, if they need to go through a physician?
You can, or you can refer, but before we can start therapy, before we can do the evaluation, you have to have that physician order. So you can't just walk into our clinic and say, all right, I'm here.
Oh, okay. Good to know. Is there a growing demand in this field across the country?
Yes, because we, as speech therapists, can work in schools, you can work in hospitals, we can go clinics, we can do nursing homes, we can work for ourselves and kind of contract out. So yes, there's a big need.
Is there a shortage of therapists?
I don't know if there's a shortage, but there's definitely, there's a spot for you. That's
Okay.
for sure.
That's good to know. So for folks that want a little bit more information about what is offered at Hannibal Regional, do you have a web presence or a direct phone?
You can actually go online, and we're actually working on the website right now. I'm not sure if it's up and running. I'm kind of in the middle of doing some of that too, but hrhonline.org is where you can kind of get more information.
And speech therapists at Hannibal Regional have some sort of special certification, is that right?
Yeah, there's, like I had mentioned before, there's 4 of us, and we are certified in the Birth to 3 program, which is called First Steps in Missouri, since we're in Missouri. There's some of us that are certified in a voice program called Lee Silverman. We're all certified in Vital Stem, which is a therapy technique we use for swallowing. There's Deborah Oral Beckman. There's all kinds of certifications, but those are some specific ones that we have at Hannibal.
Is there a requirement for ongoing education or like a peer review?
Yes, we have to have so many continuing education units every 2 years to continue and keep our license going. Yes.
Okay, very good. Again, if there is any sign, any inkling that perhaps maybe somebody that we know, somebody that we care about needs some of this therapy, we can just contact our personal physician or maybe get a hold of you and get more information.
Absolutely.
And you made some great progress in speech therapy, especially with folks having strokes and that you're able to rehab them pretty quickly in some cases, right?
Yeah, in some cases, everybody's different, but definitely you can see, some progress.
There's a glimmer, there's that hope
Yes.
right there. All right. Excellent. Emily Hinkle, speech therapist at Hannibal Regional Hospital. We appreciate your time this morning. And
Thank you guys
some
so
great
much.
information there.
Thank you.
And again, always there's a role to be filled, and that's a good thing. We appreciate it. And for more information, you can always go online, hrhonline.org, of course, for more information. And that's your weekly capsule of health information, your healthy dose.